Welcome to the So Why podcast with Step Care Solutions. So why are we excited about Step Care 2.0? SC 2.0 is an innovative and transformative model for mental health and substance use healthcare that leverages collaborative efforts and technology to transform systems for better access and outcomes. And SCS exists to help organizations and communities reframe, rethink, and redesign the delivery of mental health services through flexible, open access, recovery-focused approaches. On this podcast, we explore issues and challenges, as well as ideas and solutions around how to create person-centric systems that are holistic, accommodating, and thoughtful. My name is Shauna Cronin, Vice President, Strategic Partnerships and Communications at Step Care Solutions, and I will be your host for this episode. My guest on this episode is Lori Spadorcia, Senior Vice President, Public Affairs, Partnerships, and Chief Strategy Officer at the Center for Addiction and Mental Health. Lori Spadorcia is a seasoned executive in strategy, communications, and system transformation, a thought leader with a demonstrated commitment to engaging partners and influencing public policy. Lori is dedicated to driving social change. As CAMH's Senior Vice President, Public Affairs and Partnerships, and Chief Strategy Officer, she leads cross-organization strategic initiatives, including the Academic Health Centre's role in building more equitable mental health care and supports across Ontario. She has led the development and implementation of an ambitious strategic plan to redefine health, placing mental health at the center of healthcare and including social determinants of health as key forces in the health and well-being of Canadians. CAMH is Canada's largest mental health teaching hospital and one of the world's leading research centers in its field. With a dedicated staff of more than 5,000 physicians, clinicians, researchers, educators, and support staff, CAMH offers clinical care to nearly 40,000 clients each year. The organization conducts research, provides expert training to healthcare professionals and scientists, develops innovative health promotion and prevention strategies, and advocates on public policy issues at all levels of government. I am excited to share my discussion with Lori about reframing mental health narratives and systems from a scarcity mindset to person-centric approaches focused on capacity. So Lori, I'm really excited for our conversation because you and I like to talk a lot about systems and how they work and how we develop meaningful systems. So today we're going to talk a little bit about sort of the state of our system, our mental health, substance use, health, and addiction sector broadly. What is impacting on it and where do we think it could go? So I'm going to ask you a little bit about scarcity mindset. We've heard a lot about this. This is sort of a narrative that exists a lot in our sector. So can you tell me, what is scarcity mindset? How does it show up and impact partnerships, connections, and the work that we do within the system that we work within?
Yeah, thanks. So happy to connect again. And, I feel like we do a lot of imagining together. So these are always great conversations. So the scarcity mindset really is kind of looking at things from sort of that deficit perspective. And I think in our system, obviously, we haven't been resourced to the degree that we need to be. We're not there yet. And that really has become a driving narrative for us. And sometimes when you're deep in advocacy, that deficit muscle kind of takes over. You want to sort of put out there what's not working and and when that happens, we end up sort of building walls around us instead of kind of the pathways because we're protecting and we're defending, and it kind of forces our organizations to to think about our own piece of the system rather than the system as a whole. And so we talk a lot about sort of the mental health system working in silos, and those are the types of things that really happen when organizations are, kind of competing for small pots of money or, rather than sort of joining together to find solutions. Ultimately it puts us on sort of the defensive instead of the offensive. I'm not great at sports, but I love that analogy. and that's kind of a hard place, to be, sort of curious and to be innovating. and to be imaginating. So yeah, it's that kind of protective piece.
I love that you used the word yet. We're not there yet, because to me, that indicates a lot of possibility. And so in starting to think about the possibility for how we might shift away from the scarcity mindset with complete acknowledgement for all the contextual factors that you've highlighted that I think force us as leaders in the system to struggle when our good intention or desire seems to be impeded by those barriers, those big context factors. So acknowledging that those are there, but thinking about the yet and the possibility. I want to talk a little bit about data, because I think data is very important. So can you talk a little bit about how we might be able to use data as a tool for this possibility or this yet, and not just for problem avoidance or to sort of reinforce this status quo that you're talking about?
Yeah, for sure. Data is so powerful. I mean, for many, many years, we talk about, if you're not measuring it, you're not doing it. I think it's typically associated with the word performance. And I don't know about you, but sometimes that word actually has sort of that connotation of, again, being defensive and having to it's like having to find the proof, which is true, but it can lead us down, sort of a path. And, I think, what we want to do is get into spaces where we're comfortable with data. We're comfortable with sharing it. We're being transparent with that data. It has the power to bring us to possibility in sort of measuring things that might be invisible. So, thinking about, we've got a program. Who's coming through the door? That's a natural thing to measure. That's what everybody's measuring. Who's not coming through the door? Who are we not getting through the door, and why? And if we measure, those types of things, they open us up to some possibility. And I always think about starting from sort of a shared vision, like what are our goals, and going back to those goals on the regular. I think back a little while back when we were talking about there was a justice system sector program, and the measurement was just constantly like, oh, it's attracting sort of more and more people. It's a successful program. So we were in that sort of performance mindset of the data. The data showing lots of people using the program. That's great. The program is helpful. That's also great. But it sort of made us move away from some of our other goals. I mean, one of the things that we did was we sort of at one point we flipped the narrative and asked, where do people who are coming through this program actually want to be? Where would they have been if they didn't have to access this program? And that takes you to a whole other place of imagining maybe that program in the future shrinking or not existing. And those can be uncomfortable conversations because, again, we get into that sort of protective mode. But data can be so powerful as long as we sort of look at that whole spectrum and think about what isn't there.
Incredible example, because to your point, we can look at the numbers and sort of get into that very binary, successful, not successful kind of space in our brains, which humans like, but it takes out that curiosity that you're kind of really focusing on. And what I love about what you're saying is there's a very human aspect to that. What do people want? How can we humanize these services, these programs, these journeys, so that maybe they're just part of a continuum, but they could be much smaller, or they might not need to be there forever. They could be more ephemeral. Could we get to a place as a sector where we're okay with an ephemeral nature of what we're providing and keep it focused on humans? So in that sort of line of thinking about how do we keep things focused on humans, I want to ask you a little bit about this deficit versus sort of abundance narrative that you and I and others have spoken about before. And how do we get to that abundance narrative where there's so much to leverage? So how can we move from telling deficit-based stories, and this is something that CAMH has done very well and you folks are working on, is to telling stories about the future and hope and moving us forward?
Yeah, I love this conversation. These deficit based stories can actually become like pretty exhausting. And when we think about things that are hopeful, what comes to mind is energy and inspiration. And so getting to that place, I think, is really important, because we don't go anywhere unless we're bringing people along with us. That's, you don't go anywhere alone. You bring people along with you. And, I think in the past, we've focused so much on what isn't there, but people want to know what hopeful means. And that means talking about the journey and the success, and then building on the strengths. So, if we start from a strength-based approach, we can say, here's what can happen, and we can create space, for hope. And I think about this in so many ways. Like, I think about it in, our ad campaigns and how they've changed over the years. Really started in that sort of deep, dark place. And then, as people have stepped forward, really telling those stories, of hope, has really, brought people into the fold. And people can see themselves in those stories of hope, and they then gain hope themselves. I think about the people all across, the front line in hospitals and in community care who, see people sometimes at their worst points, just not hopeful, and taking care of someone through that trajectory. There are programs where you don't know, like, you don't know what happened to that person that came through your program. But when those people come back and talk about where they are, that creates hope and energizes you to do what you're doing. And so I think, those positive outcomes, lead us to a place of something bigger than the problem in front of us, or, the person that we saw today. It's more than, one person or one organization. It is really about community. And, I think that we have to, move from what's missing and what's wrong to unlocking, like, how did we do that? And how can we build on it? And how can we grow that?
It's both the process and the journey and the impact and the outcomes, right? Everything is important. And you spoke about sort of not going alone, and that we have to bring others along with us. And to me, that speaks a lot about how do we partner well, and how do we really create collective vision for what we're trying to achieve, both within our organization, but external to our organization as well. So how do we build integration? Because it's tricky. And can you talk a little bit about how CAMH works with communities, works with clients, and works with others to think about integrated and co-designed solutions?
I think on this, we're on a journey ourselves. In our last strategic plan, we talked a lot about centering partnership and systems building, and really thinking about how do we go about all of our business with that mindset. And, I think we were just at a conference, you and I, not too long ago, and we were talking about taking our organization hats off and really coming together to sort of solve those problems. You can't do that unless you are partnering. And, that means working quite differently. It means understanding that there are different ways of and types of knowledge So, we're in academic communities. We know that scientific knowledge is really important, and hospitals' clinical practice is really important. But there's experiential knowledge that is critical, cultural knowledge, community knowledge, local contexts, geography, indigenous knowledge. And so going, the way to sort of co-design and partner, you need that as a base. You need to understand that these are valid ways of thinking and valid pieces of information that you want in your conversations. Sharing resources and power. We talk about that a lot in our sector. It's not, sometimes it's not so easy to do. But again, it goes back to thinking about who are we all serving, or what are the shared goals that we have, and then taking those organization hats off and not thinking about the resources being attached to a certain place or a certain person, but really the resources being, capacity to deliver on what we're all trying, that shared purpose and goal. And I think like building and earning trust is just like a basic thing that I think you're never there. We talk about moving at the speed of trust. But you're never entirely there. It's one of those things that you just have to constantly build, and earn and I think we've got loads of examples of co-design improving outcomes. I think about Indigenous people who walk into spaces now where they feel included. They see themselves in those spaces. They see their culture. The ability to integrate identity and culture into the healing process is something that is co-designed, and it brings a different outcome than may have been if we didn't have an openness to that. And we talk about centering the people that we serve, and we often hear like nothing about us without us. I think this is a theme through our conversation is who's at the table. Who are you bringing at the table? I always like to say, like, add more chairs, because you probably need some voices. You need the people that you're trying to serve and help and support. What are their needs? You need them to be there.
I love your example that you're providing, and it makes me think a lot about when we talk about co-design, and even I think when we think about co-design, that's where that good intention doesn't always necessarily equal good impact, because I think we often try co-design at sort of an implementation stage, or like, how is this going to look? But when you're speaking about this, it's making me think a lot about even co-designing the vision, even co-designing what we're doing, and recognizing that as we bring in diversity of voice and perspective, that might change. And it might not be what our organization thought it was initially going to be engaging or implementing, or actioning. And so I start to think a lot about like upstream, like how do we go really upstream in understanding where we should be focusing our energy? And in our system right now, there's a lot of conversation about, low barrier access or no barrier access, and population health, and how we can really try to create meaningful impact in these spaces and places so that we are reducing sort of the long-term need for more intensive services over time. So I'm wondering if you can talk a little bit about low barrier access, what it might mean, and population health, and how these might serve as anchors for us in that redesign and partnership work that we're trying to engage with.
There's no doubt. I think the health system at large, not just the mental health system, is kind of centered around crisis. So, being in that kind of acute phase is how we organize our health resources. And I think what we've learned is population health has a really big place to help us move forward. And that's because it looks beyond sort of the individual and really looks at a systemic approach. looks at populations as a whole and helps us to kind of think about things from a community perspective. Also, when you talk about low barrier or no barrier access, it leads me to things like RAM clinics where people they come when they're ready, and that clinic is then meeting them where they're at versus where the system believes that person is at or what they need. And when something is low barrier, it is usually more inclusive. It is just, it's accepting you as you are in that moment. And that opens more doors for us. One, it leads people there earlier. If it feels safe and inclusive, if they're not waiting around months for appointments, but they can walk through a door, that first connection or that conversation could make a huge difference in the trajectory. And we know for sure that people are not getting care early enough and not getting support early enough. And I think getting upstream is certainly one of the goals that we have in our strategic plan, and we talk about it right through the lifespan. So investing early in children and youth, so that we're starting lives out and putting the best possible supports in place in communities and in schools and supporting families. And then as people are, on that journey, what's happening to them where they can actually walk into a place to ask for help. And I think, part of that is eliminating stigma, in having sort of more wider services that are sort of outside of what is typical of healthcare.
So Lori, hearing you speak about this, it makes me think too about some of the work that we do at Stepped Care Solutions when we're trying to design ecosystems that have low barrier access. A big part of the model that we know is important is one at a time or single session therapy where people can get exactly what you're saying. And so I was thinking a little bit as you were talking about how we have certain programs that can support, but we also are trying to make ecosystems that are comprehensive to be upstream or low barrier or no barrier access. And part of that is learning actively what people need, learning what the data is telling us, kind of bringing together all the parts that you've spoken about from the different ways of knowing or different types of knowledge, and then applying it. That sort of knowledge to practice loop. So I want to ask you a little bit about learning health systems, because CAMH has been working very hard on trying to establish learning health systems as a way of working. And I think pulling together a lot of what you shared so far. So can you tell us a little bit about what a learning health system is, what it means? Because I think there's a lot of different perceptions and maybe not aligned definitions of what it is. So what does it mean to you? What does it mean in the work you're doing? And how might it help us close the gap between what we know works in research and what we actually see in practice, which we know is sort of that 17-year gap between knowledge to practice. So if you could help us understand a little bit about what a learning health system is and how it can help with that knowledge to practice gap, that would be wonderful.
Yeah. So learning health systems are, I think you use the words the loop. And I always think about a circle when I'm talking about a learning health system. So really just constantly learning, continuous improvement. So it does close that 17-year gap that you're talking about. It's putting things out there into practice, but not just leaving them there. It's like measuring as we go. And so that is really an evolution. It's an inclusive, it is transparent. It brings a lot of people in that ecosystem together to learn and evolve. And so, when I think about that that 17 years that you were talking about. It's like, it feels like, oh, you invest in this research, and then you put it out there, into practice, and then you sort of let go, versus, in a learning health system, everybody is kind of around the table and actively, monitoring and talking about, what the data, is saying. And, what I like about it is that it does build a larger table. It's it really is about bringing community, bringing the people that you serve, to that table, and understanding how people feel, through that system, what is important to them, and just actively, measuring, all the way through. So, you collect the data, you learn from it, you apply changes, you collect more data. Like, it's sort of, it feels, kind of, a lot of common sense, but it is a very active and inclusive way of measuring and, continuous improvement. And, in my mind, I feel like we need as much as we can to close that gap. That gap in years. We need innovation. We need nimbleness. We need to work quickly. And so learning health systems basically help us to do that. And, also build trust and transparency in these processes, because everyone is around that table together.
I didn't mean to laugh so hard when you said it's not just like building something and putting it out there and then ending. But I did, so I'm glad I'm on mute. But it makes me think a lot about how a lot of what you've shared so far when we talk about, the work moves as fast as trust and the learning health system and partnerships and trying to ensure that we have more seats at the table. A lot of this is about understanding that we're in a continuous journey of learning and application, and that is okay. Like, I think there's another piece around giving ourselves in this sector permission that transformation takes time, and transformation is hard work, and it's continuous work. And there's celebration in the moments. There's movement in the moments, but that isn't a failure of implementation when we have to have small incremental change over time. That is actually how it should be happening, because then we're trying and we're learning, to your point, actively. And a really beautiful example of this is Youth Wellness Hubs Ontario, and the work that you folks have been doing and engaged as part of a larger national and international movement around youth hubs. And so can you talk a little bit about the learning health system approach you folks are taking in the context of youth wellness hubs in the province and nationally?
Yeah, absolutely. And I think you just actually spurred me on to, the word failure, and how that can be a really uncomfortable space. And, in a learning health system, we are evolving all the time. And hopefully we're seeing that, if we need to pivot, it's okay to do that. So creating that safe space to do so is great. And it is actually, when you're in the midst of that and you try things out and you need to pivot and change in the moment, it's really powerful, and it's actually energizing to be able to, it feels like you've got agency to try and to innovate, So, I just wanted to honor that, because I think that is a really important part of it. And certainly with youth wellness hubs and integrated youth services across the country, because there are so many right across the country now. It really is, kind of taking that learning health system approach and bringing all of those people and all of that knowledge around a table and co-designing. So that co-design is like baked in right from the beginning, just as we've been talking about through this conversation. And so people are in it together. There's young people, there's families, there's clinical folks, community, cultural knowledge, and then what we do is we've got sort of a network of hubs, and that just grows the learning health system. So when you've got like sort of a network and networks, and we know that there are integrated youth services across the country, that that allows us to learn from different places. So you could be in downtown Toronto and learning also about innovations in rural and remote areas that could or could not be applicable. Or you may have certain populations that are coming through your doors at greater numbers in different areas of the country where they're learning, because of that critical mass, they're learning a little bit more than maybe someone in a different area. And the learning health system allows you to expand. And I think, we've talked a little bit about low barrier access and, social determinants. And I think, what excites me the most about integrated youth services is just the way that we are redefining health for youth. And we need to pull that right across the system in a really big way, because we talk about social determinants and low barrier access. Young people told us about what are the spaces that they want to walk into, what do they look like, what needs to be there, and it is for sure access to primary care and to mental health resources, and it's also access to housing and employment. And all of these things, we know them. We know this to be true. We know that the social determinants are actually key determinants to health and well-being. But we haven't organized our system around them in this way. But youth hubs are, one of the ways that we've shown that every door really is the right door. You can walk through that door and you can get access to a number of different doors. And that is, that's really truly low barrier.
It's really exciting to hear. And this when, you and I had the opportunity to work together in the same organization. Youth Wellness Hubs was a big part of the work that I was engaged with at ChemH. And I think it's so exciting to see it kind of come full circle like this to also be this learning health system. And I think my hope for the future is that we can also learn about the learning health system. Do you know what I mean? And as a system, we can understand more about what are the core principles of good system design work and how does that look? And how can we scale that across our country as well? Because more and more organizations have to look beyond themselves because we're working in complex systems, and those complex systems impact even the smallest program that we might be implementing within our own organization. So a lot of that is around change management and large-scale ecosystems and large-scale ecosystem change. And as we come to sort of the end of our time together, I want to ask you a little bit about leadership. Because you've been engaged in a lot of these sort of big systemic change pieces, change leadership is sort of on my mind a lot lately, and I know you and I have had interesting conversations about this. So I want to get a sense from you, for you as a leader, how do you balance trying to propel all this systemic transformation and organizational change that needs to occur and programmatic change while also trying to support people on a very individual and human level, particularly around potential feelings of loss, confusion, and discomfort with the change? And you sort of alluded to this earlier, that can be hard.
For sure. And it can be hard on individual people. It's hard for institutions to change their cultures towards, towards this kind of change. I always say that change is kind of the constant, especially these days. But back in the day when we talked about sort of change management as a process, now it really is just the way that we operate. And I think that what is needed is, again, just bringing some of the themes together that we've talked about today, is bringing people along, because we're not going to drive systemic change unless we put the puzzle pieces together. We can't operate in like one organization's mindset and then expect people to get the kinds of access to the supports that they're looking for. So it really is sort of bringing people along. from a leadership perspective, there are some things that, kind of really stand out to me. Transparency and trust are two things. We talked already about earning trust and how important transparency is. Often during change, big changes, it can feel more comfortable to hold information, but my goal always is to share as much as possible so that people are on the journey, together with you, and they feel like they are empowered to be a part of that journey. Honoring the past is a big deal. You don't we want foresight. We want to move forward into the future, but honoring the work of the past, honoring the decisions of the past, honoring, just generally connecting that to the evolution of where we're moving to. I just find it helps to bring people along. And it also just allows us to celebrate and recognize progress along the way, versus sort of saying, oh, we're going to do things differently now. And then, I love healthy tensions. I love being in a room with healthy tensions. I feel like you get to a better place if you, again, you bring those tensions to the table and you work them through. They're all information. It's all feedback. It's all, it can be in a healthy space. It can be very productive and can bring you to, to a better place. And then, you and I have talked about this so much. We can get so busy and so into our days, but keeping our eye on sort of that North Star and what is, our shared goal and vision. Sometimes, especially in big institutions, especially when you're a little bit further away from sort of the front line, and when you're in these kind of systemic or system conversations, you can that distance can sometimes pull you away from that shared goal of improving access and improving care and supports. And you have to constantly bring that to the table. I find you have to constantly kind of recall that and place it at the table.
Yeah, great points. And I love that idea of healthy tensions. I find it's always so, it really puts you in that growth orientation or that growth mindset when you're with others, kind of, challenging each other and trying to build the best solution possible that's grounded, exactly as you're saying, in that North Star. Why are we here doing this work? And from an implementation science perspective, we always say we should be working ourselves out of a job, right? Yeah. And if we kind of ground ourselves in that, it changes the way you think about what you're building or what you're trying to achieve or why you're working together, to kind of loop back to your earlier point. So we've come to the end of our time together, and as always, it's a wonderful conversation, and you're so insightful, and so it's lovely to kind of hear your thinking. I want to end by asking you if there's anything that makes you excited or hopeful about the future. So, what really keeps you going in this work?
So much. These conversations are always super energizing. So I know I'll walk away from here and think, oh, I forgot to say this, or, I'll call Shauna up and we need another coffee. But it can be hard to be hopeful these days. Let's just tell the truth. This is a hard time for the world. And, but at the end of the day, I'm constantly reminded on a daily basis about hope and the future. I put people sort of first in that. People in our sector are relentless and, just continuing to push forward. People with lived and living experience and the determination and courage that they show on their journey energizes me. And I challenge anyone to spend a day with young people who are determined to drive change. It will change you forever. And so the more we bring young people to the table, there is a lot of hope there. And then, progress, going back to that sort of deficit mindset, it's easy, and there's like sort of this crutch that we sort of bring along with us about all the things that are wrong. But it's really important to talk about our progress often, to celebrate our progress. I have been reflecting on my career in this mental health space because it's been almost 2 decades, and I could count on one hand the number of people who back then wanted to talk about mental health. And now I'd be hard pressed to find someone who doesn't want to talk about mental health. And that is really critically important. It has led to so much action. And so I think we have to keep our eye on that ball and stay in that strengths-based place and move forward. And then partnerships. We've talked about this through this whole conversation. It is wonderful to work with people. It is wonderful to learn from people. And when you take your organization hat off and you all have a shared vision towards a North Star and you're working together, that is truly sharing power, and learning together is so inspiring, and it gives me a lot of hope for the future. And I feel like we're doing a lot more of that. And so that's super hopeful. And, as I said, it is a tough world, but our movement, I call it a movement, is centered on connection and community. And I just believe that's exactly what the world needs more of. So let's just step up.
Words to live by right now, I think. And I totally agree. I think there's a lot to be hopeful for, and hopeful about. And I love the simplicity of your example, even just across your career, seeing that shift in stigma and that willingness to lean into conversation. There is change happening. There is movement happening, and we need to celebrate along that continuum, that journey of transformation. Lori, thank you.
Thank you. Thanks very much. It's been a real pleasure, as always, to have this conversation with you.
Thanks, Lori.
And I'm looking forward to many more.
Me too. Thanks again to our guest today, Lori Spadorcia, Senior Vice President, Public Affairs, Partnerships, and Chief Strategy Officer at the Center for Addiction and Mental Health. For more on the work of CAMH and other key items of discussion from this episode, please find links in our show notes. I'm Shauna Cronin, Vice President, Strategic Partnerships and Communications at Stepped Care Solutions. Thank you for joining us on this episode of the So Why podcast.